All right. So, as you know, if you haven't been here and this career events, you have to check in so that your teacher knows that you are here. And if you have questions, this is a great questions that you can great question document that you can reference to, and the evaluation form. This is how we give you attendance and give you credit. And if the QR code doesn't work, we will have the Bitly link and the actual link in the chat, and be fully present. This is a good time to ask question and don't keep looking at your phone. Just, pay attention. And again, this is the evaluation form is very important. This is a requirement for you to graduate in Oregon. So that is it for me. Let's have Robin talk about a career as a certified nurse assistant and the company more consulting.
All right. Oh, sorry, making sure my computer is cooperating with me. So I guess a little bit about our company. We're based out of Hillsboro. So we're right in downtown Hillsboro. We are going on our 5th year of business, and we teach CNA1, CNA2, and medication aid classes, or CMA classes. We have been, like I said, we've been doing it for 5 years now. We teach CNA classes pretty much every single month. And then our CNA2 and Med Aid kind of alternate months. We are seeing at the beginning of COVID, we saw a huge spike in the need for CNAs. And still right now, we have a huge need for CNAs. So it really is a good career opportunity to get into. There's definitely a need for it. So what I'm going to do is I'm just going to talk about each of the different programs, focusing more so probably on the CNA since that's our first step. And then I'll touch on kind of the CNA2 and the Med Aid. And if you guys have any questions, feel free to ask as I go. That's totally fine. So first of all, a CNA is a certified nursing assistant. Let me take off my glasses because those are like causing a glare. CNA is what works in skilled nursing facilities or nursing homes. They're the ones that provide the immediate care and what we call ADLs, or activities of daily living, for the residents or the patients in those settings. That can be bathing assistance, assistance with grooming, brushing their teeth. It can be mobility assistance. There's range of motion exercises that CNAs do as well. Anything that somebody who, think of everything that you do on a daily basis to take care of yourself. Somebody who is unable to do any of those things, CNAs are the ones that do those for them in place of that. So it's a very rewarding career path also, because so many people are embarrassed or feel bad, or they go through really bad depression when they start to lose mobility or lose function of certain things of their independence. So it can be a very rewarding career path. For our CNA program, it's called our NA1, and that confuses a lot of people. I get a lot of people question if that's actually a CNA program. While you're in the program, we refer to it as an NA1, a nursing assistant 1. And once you pass your state test with the Oregon State Board of Nursing and you get your license, that's when you actually become a CNA. Until that point, we don't refer to you as a CNA, we refer to you as an NA. And that's because technically you're not certified yet. So just to clear that up, because a lot of people get very confused on that, or they think that an NA is something different than a CNA. It's just an uncertified CNA. It means you just haven't passed your state test yet. With our CNA program, there's no prerequisites to get into a CNA program, or specifically ours. I can't speak for all of them. Specifically ours, there's no application process, no interview process. We handle things first come, first serve. We do get very busy during summer. Summer's a big time for people to take CNA programs because they're off of school or off of college for the summer. The only, I guess, requirement per se is that you have to be 16. So technically, high school students, 16 and above, can actually take a CNA program. Most places will not hire you until you're 18. You may find some facilities, or maybe even an in-home care, that would hire under the age of 18, but because of there being a little bit of a liability with somebody being under the age of 18, sometimes that's harder to find. But technically, once you turn 16, that's the only requirement I need to get you enrolled for one of our programs. So it's a great opportunity for you guys to get a jump start on a career path, and already have that under your belt. CNAs right now in most places, during, I guess it was probably like six months ago, within the last year, CNA, the wage increased. So in a skilled nursing facility, a lot of CNAs are starting in around the $18 an hour range, which again, for someone fresh out of high school or somebody that's young, that's just starting on a career path, that's a really good wage to start at. And you do typically, most of the time in the medical career, you also get shift differentials. So with that being said, swing shift, which is usually somewhere around a 2 to 10 p.m., gets a little bit more than a day shift, which is around a 6 to 2 p.m. And then night shift, which is usually around a 10 p.m. to 6 a.m., gets the largest shift differential. So you'll make the most working a night shift. And again, a lot of our students, because they're in college, or we haven't had a ton that are still in high school, but we have a lot that are in college, that knock shift or that overnight shift is something that works the best for them with their school schedule. And so they have an opportunity to make quite a bit more working that night shift. So it's a great opportunity for you guys to kind of get a jump start on that. So the CNA program, our particular program is only 4 weeks long. It's a Monday through Friday program. It is a full-time program, so it is 8 hours a day. The first 2 weeks you spend in the classroom doing the knowledge portion and practicing the skills working in the lab. And then the second 2 weeks is when you are actually in your clinical portion, and that's when you are on the floor working with residents and patients in our clinical setting. Right now, our clinical setting is a nursing home in Beaverton. A lot of people are pretty familiar with it. It's actually Maryville, which is on the corner of Farmington and Murray. It's a very big facility. So you get to work with a lot of different residents. You get to work with memory care residents also, which is my passion. I love working with memory care, but you'll get a lot of experience doing the clinical there. What high school and college courses have you found to be most applicable or important for your occupation? For a CNA, for a CNA, it's really the first step. So doing anything with revolving around health sciences, I think is going to be huge. Anything that you can take, even around nutrition. A lot of people don't think about that, but even taking some courses around nutrition would be great also, because people who elderly or people who are medically compromised or immune compromised, nutrition is huge. We have a hard time keeping them, I guess, hydrated, and they tend to lose a lot of weight. So as odd as that may sound, having a little bit of knowledge on nutrition also would not hurt. Same with even stuff around physical fitness. I almost said physical therapy, physical fitness classes. Doing things around that also would be helpful. Any knowledge that you can get about physical health, even mental health. Mental health is going to be huge also. Oh, I see, I missed one. Is a CNA still prerequisite for a nursing degree? Yes. So if you do want to go on to be a nurse, most colleges will require you to take an NA1 program prior to applying or prior to starting. That's going to be one of their requirements. Some of them have a CNA program built into them where you don't have to take a CNA program separately. It's kind of built into your first year. A lot of them, though, will require you to go through a separate NA1 program. So that's another thing that's good to get under your belt when you're still in high school, or even like if you're graduating this year, getting it knocked out this summer. So that way, when you do apply to a nursing school or you start looking at different nursing schools, that's one requirement that's already knocked out. With that being said, one thing that's a little bit different with nursing schools is that they don't require you to actually get certified. So as I was talking about just a little bit ago, how we refer to you as an NA1 compared to a CNA1, to work in a skilled nursing facility or to work with patients and residents, you have to be certified. For a nursing program where you're not going to be working, you're just going to be focusing on your nursing program, you technically only have to be an NA1, which means that you just pass our class. You get your certificate of completion, and that's all they ask for is just that certificate of completion. You don't have to actually be registered in the State Board of Nursing or anything. But with most of our students, what I do strongly encourage them to do is, even if they are going directly into a nursing program, we have a lot that go to Concordia. And so we have multiple Concordia students that come through. Even if you are going directly into a nursing program, I still strongly encourage our students to get certified. Even if you know that you want to go on and be a nurse, get certified, because you only have a year to take your state test to get certified. And the sooner the better, because obviously when the knowledge is fresh in your head, you're going to do better. But it will look better on a resume, because instead of just saying that you completed an NA1 class, you can actually list out your license and say, you know, I'm registered in the State Board of Nursing as a CNA. I actually got my certificate from the State Board of Nursing, instead of saying that you just simply passed our class. So it definitely looks better on a resume, and it's something to fall back on. A lot of times students come out of high school and they jump right into college, which is great. But sometimes there's a little bit of a, I guess, shock to the difference in college compared to high school. And sometimes things don't always work out. Sometimes you have to cut back on your class load. Sometimes you may realize, oh, this is a little too much for me. I'm going to take a year off, whatever the reason may be. Then you have your CNA, you have your actual certification in the state board, to where you can fall back on that, where you can either say, you know what, I'm not quite sure if I want to be a nurse or not. I think I'm going to maybe work a little bit as a CNA, see how I feel about it. Or if you cut back a little bit on your hours and all of a sudden you're like, oh my gosh, I need to start working, you can work part-time as a CNA while you're going to school, whatever variation of that. So I do strongly encourage people to still get certified. And having experience, again, on your resume, having experience actually working in a skilled nursing facility will help you greatly overall when you do start applying for jobs. It'll also help you in nursing school, because the things that you're learning in nursing school, you're going to start getting firsthand experience with them through your job as a CNA. And most places really want that experience. They like seeing that experience on your resume. And I will tell you firsthand, most of the best nurses have started as CNAs, because they understand the kind of bottom of the food chain there and they've worked their way up themselves. And so they make some of the best nurses, because they work well with their staff. They're great leaders. They know the job even more. Whereas a nurse that just jumps into being a nurse and has never experienced being a CNA, not saying that she or he won't still be a great nurse. It just gives them a different perspective, kind of working their way up. Let's see. What is a typical day in your work life like? So for CNAs, it really depends on the shift that they're on, because every single shift is very different. So if we look at a day shift, for instance, day shift is the busiest shift. You are going to get there and immediately, like, you get there at 6 and you're going to start waking people up and getting them dressed at 6:15, because there's a lot of people that wake up first thing in the morning. So your first, I guess, task of the day is going to be getting everybody up, all of your patients and residents up, getting them dressed, either getting them ready for breakfast in their rooms or getting them down to the dining room to have breakfast. A lot of places, usually I'd say breakfast is probably around 8-ish. And again, all of this is going to vary facility by facility. And once you get really good at it, you may have, typically, I'd say a CNA probably, the lowest amount of patients I've seen a CNA have in a skilled facility is about 5 or 6. The highest, sometimes, well, I would say the average, because I haven't necessarily seen the highest. Average, I would say you probably will have 10, 12 residents per yourself. And you will get in such a routine that you will have all of them up and ready for breakfast within only that 2-hour time period. And their level of care is going to vary also. There's going to be some that you're going to have to actually use Hoyer lifts, which is something where it's it's kind of like a mesh. I don't even know how to describe it. It's where we basically have to physically lift them in the air with a machine to rotate them and put them in their chairs because they have no mobility at all. Then you have some that are independent, that they can get up and brush their own teeth, but they have things like ostomies, which is something that is where the bowel is attached to a bag. And so their BM goes into a bag instead of going to the bathroom like we normally would. So it could be something as simple as that, where they're completely independent, but they have this one thing that they need assistance with. Could be that they just need assistance with transferring. But anyways, you'll get everybody up, get them ready for breakfast. After that, it's usually potentially laying people back down for naps. Then you kind of repeat for lunch. Then you always do a shift change when the next shift comes on. And sometimes it's also getting people ready for doctor's appointments. Swing shift, very simple. Well, I shouldn't say very simple, but you have dinner that you focus on, and then it's the opposite. It's getting people ready for bed. And they'll have treatments like lotions and things that you may need to apply to them. And knock shift is just routinely checking on everybody. If they're incontinent, changing their briefs for them, and just making sure everybody stays safe overnight. Every day is going to vary. Sometimes you're going to have very, very easy, mellow days, and other days, everything's going to go wild on you. It's going to vary. Let's see. Can you study for a nurse to become a doctor? I'm not 100% sure if there's a bridge program for a nurse to a doctorate. You'd have to look specifically at the college that you're looking at, or look specifically for programs like that. I know that a lot of nurses, especially ones that come through our program, their overall goal is to be a nurse practitioner, which is kind of like one step below a doctor. And so that I see a lot is where a lot of students say that, oh, they want to start as a CNA, then they want to get their nurse, and then they want to look at getting a nurse practitioner degree. Is it better to be in long-term care or Alzheimer care? So working in memory care, Alzheimer's, dementia care is actually, so Alzheimer's and dementia, you don't have to be a CNA to work with them. You can simply just be a caregiver. Long-term care, you're required to be a CNA. So if it's something where you're like, I don't know if I want to go through a CNA program, then definitely looking at a memory care, which those are called RCFs, resident care facilities. You can get hired with no experience at a memory care facility. Again, they probably prefer experience, but that really is like the first step to getting experience. So if you're kind of up in the air about, I don't know if I want to actually do a CNA program or not, then definitely starting in an RCF where you can work in assisted living or memory care will kind of get you that little bit of experience to help you decide if you want to go on to be a CNA or not. Why did you choose this profession, and what steps did you take to get into this profession? I love working with geriatric, and I just love working with medicine. I love being able to help people. And so I actually personally, I started as a caregiver in an RCF. And I kind of worked my way up from there, got an administrator's license where I actually oversaw assisted livings and memory care units, which is separate from skilled. Like I said, those are considered RCFs. So they're a little bit different. You don't have to be a nurse to oversee those and kind of assist with those. And I just it kind of just took off from there. I just found a real passion for it. But I started as a caregiver, and eventually I did get my CNA. And I never actually worked in a skilled because I found that I loved working with memory care the most. But then we started our business and now I get to kind of be your guys' personal advisor and help you guys on making those career choices and career paths also. Let's see. In your own opinion, is the night shift a lot easier if you're a beginner? For a beginner, I recommend swing shift. Night shift can be very mellow, where you literally are only changing briefs and checking on people every 2 hours. Whereas swing shift, you actually are helping with meals, you're helping with their nightly routine, and you're getting to interact with them. So that, I think swing shift would be the best shift. Typically, we do not recommend brand new people to go on to day shift. That's even coming from me as a previous hiring manager for my day shift. Day shift is very busy. It can be very chaotic because, again, we have family members coming in to visit, we have doctor's appointments, we have 2 different meals that are served on day shift. So day shift sometimes can be very shocking to someone that's not used to it. It definitely goes by faster. There's a lot more, you're going to be moving a lot more on day shift, but starting out, I would recommend a swing shift so that you kind of slowly get into that routine. And then eventually, if you want, you can then apply and transfer over to day shift. But usually, most places, um, well, right now, because they need people, they're putting people on day shift. But most of the time, they start people on a swing shift or a knock shift, not typically a day shift. Are able to volunteer at nursing homes to get experience and see if the nursing field is for you. You definitely are. That's actually a great thing to bring up. So volunteering, they nursing homes and assisted livings and memory cares, all of them love to have volunteers, and the residents absolutely love to have people come in and talk to them. They get very lonely, as you can imagine. They're kind of especially memory care and skilled nursing. Memory care is actually a locked facility, so they can't leave. And skilled, some of them have such limited mobility. Sorry, I felt like I was going to sneeze. Some of them have such limited mobility that they can't get around on their own. So, them being able to go and socialize with people or even going outside on the patio and enjoying the sun is very limited. Because, like I said, if we have only one person managing 10 to 12 people, sometimes we may not always have the time to go out and sit for a half an hour with a resident outside. Typically, we don't have the time for that. So definitely volunteering would be huge. And you can typically do that by any facility that's near you. You could typically either go on their website or you can even give them a call and say, hey, I'd love to volunteer. Is there something that I can do? Most of the time, you're going to volunteer with the activities director. And so you'll do things like helping call bingo. You'll do things like arts and crafts with them. You can even come in and read a book to them or just sit and socialize with them. It all is going to vary on the facility and and the individual resident. But definitely volunteering would be huge, and that would get you firsthand experience watching the CNAs and seeing the environment, seeing if it's something that you could handle or not, and also working with the residents, because sometimes it can be very sad. It can be very hard to see the residents going through certain things. So a CNA is definitely not a job for, I guess, I don't want to say a weak-hearted person, but somebody who feels a lot of emotion. If you're a very empathetic and compassionate person, sometimes that makes you an amazing CNA, but sometimes that can be very hard because you take those things to heart. It's very hard for you to see your residents in rough spots. And obviously, our residents do pass away on us. And so sometimes that can be very hard. So doing something like volunteering, yeah, that would be a great way to kind of see if you can handle that environment. Can you choose a shift that you want? Typically, when you do a job interview, they will ask you your shift preference. They'll say, oh, what shift would you like? And you can tell them, well, I'd love a day shift. And they'll say, okay, well, we'll see if we have day shift available. What's your second choice? And so you can tell them, well, I'd like swing shift. Most of the time, they'll ask you what your first choice is. Then they'll tell you, well, actually, we only have this or this available. Um, it kind of depends on the facility and what they have available. I would not count on picking your shift though. Most of the time, they just tell you this is what we have available, and you have to make yourself available for that. A lot of CNAs also, one thing to point out with shifts is, as I mentioned, we have a day, swing, and knock that we typically follow. But CNAs also tend to work on a rotating schedule, which means that they work 4 days and they have 2 days off. So that changes their days off every single week. So they may work Monday through Thursday this week, and then 2 days off, which means they'd have Friday and Saturday off, and then they work Sunday through Wednesday the following week, and so forth. Most places have them on a four on, 2 off rotation, so that every week their days are different. Some people really love that. Some people are like, nope, I need set days off. So that's something to keep in mind also, is that you will see that a lot for CNAs in skilled nursing facilities. What are the most important skills and or personal qualities needed for this job? You definitely have to have compassion. You definitely have to have empathy. You definitely need to be organized, because you're going to have you carry around, either you carry it on paper, or a lot of places have switched to electronic. You're going to have your, oh my gosh, tasks for the day that you have to follow. And again, like I said, you're going to have people that have doctor's appointments and things that you have to get them ready for. So being detailed and organized and knowing how to handle that. You also have to be able to handle stress really well, because it's going to be really, really stressful. So having something outside of work, like a hobby, or eating good physical activity, making sure you stay hydrated, all of those things are going to really help your stress level, because you have to stay mentally and physically healthy if you're going to do this job, because of how much of a toll it can take on you. And you also have to not be angry. You have to be patient, because we do have residents who have mental impairments such as Alzheimer's and dementia, or some that are just cranky because they hurt or they don't feel good, or they're mad that they're locked in a facility, whatever it may be. And sometimes they have bad days where they just yell at you every time you come in. They try to hit you away. They do not do anything for you. They make you work extra hard that day. You will have residents that have bad days like that, or you may have a resident who just is permanently a rough one to deal with. And so having patience with them is going to be huge. One thing we do push very much, that I am very firm on, is that you constantly have a smile on your face. If you, at the end of your day, if you need to step out or on your break, you need to step away and take some deep breaths, even have a small cry because you're just feeling the emotions today, completely fine, completely normal. But we make sure that we don't show those emotions to our residents or to our patients. We permanently plaster that smile on, so that even if we're having a really bad day, we don't show it to them, because they can feed off of our emotions very easily. So if you come in with a bad attitude, they will have a bad attitude with you. So got to make sure you come in positive. Let's see. Do you need a required amount of experience to move on to a CNA2? Let's see, how do you feel about the job outlook, the compensation, and the opportunities for growth in this profession? So let's go ahead and kind of talk about moving up to a CNA2 and the different opportunities. So CNAs, first of all, are going to be around long term. They're not going anywhere. So it is definitely a 100% secure job. If you want something that you can always rely on, CNA, medical field. We are always going to need nurses. We are always going to need nursing assistants. That's not going to be going anywhere. So again, like I said, it's a great thing. Even if you're not sure right now, if you get that CNA under your belt, that's something you can always fall back on. You do have to make sure that you work a certain number of hours within a 2-year span to get recertified. So even if that's that you work on call for a facility, like even during summer, a lot of facilities will have students who go to college and they come back and they work only June, July, and August for them. They leave again. Sometimes they even have them come back and work the 2 weeks at Christmas for them, and then they leave again. So you can, if you have a facility that's willing to do that with you, we've done that many times also. And that gets you kind of like that minimum. Or if you're in school full time, and you want to just go down to on call, and you know what, I actually am free this weekend, I'm going to go ahead and pick up that 8-hour shift or that 16-hour shift this weekend. Some of them are totally fine with you being on call as well. So for CNA2, requirements for a CNA2, you do have to be 18 to get your CNA2. There, for our particular program, for our CNA2, we do not require any experience as an NA1 or as a CNA1. Some programs do. You'll have to see that in their prerequisites. Our particular program, we do not require any experience. So we have a lot of students that get their CNA1, and the second they pass that state test, all I need is to be able to find them in the state board registry and find their license number to know, yep, they are in the registry, they have passed their test, and I can immediately then enroll them into a CNA2 program. So we have a lot of students that, based on the timeline of when they get their test done, and when they get their license released, they may take our NA1 program, let's say in June, and they're back in our CNA2 program by September. It's very quick. We have a lot of students that will immediately jump into a CNA2 program. We do I do encourage my students to get experience in a skilled nursing facility as a CNA1 before or during when they're getting their CNA2. But that has changed. Things have changed a little bit with COVID, which I'll go over in just a second, some of those changes. But CNA2s, CNA2 get paid more. So CNA2s do get paid more. If you're a CNA2 working in a skilled nursing facility, you may not, because they don't require CNA2s. So you may still get paid the same as a CNA1. But CNA2s are what you will find in hospitals. Hospitals typically are where CNA2s work. Their skill set actually just expanded back in August. So there's a lot more that they're able to do. They can check blood sugars. I don't remember all the stuff they can do. They can do everything that CNA1 does, but then they can also do, I think there's specimen collecting that they can do. There's different equipment that they can use. So there is a higher level, higher skill set for them. The other nice thing with the CNA2 is that there is actually no state test for CNA2, which is super nice. So, excuse me, when you take your NA1 program, you take that state test, pass it. It consists of a knowledge portion and a skills portion. You are listed now in the Oregon State Board Registry as a CNA. Once you take a CNA2 program, all you have to do is pass that CNA2 program and boom, they automatically update you as a CNA2. There's no actual state test. You don't have to go back to the State Board of Nursing. They automatically kind of bump you up there, which is super nice. It's nice to not have to stress about that state test. And like I said, they do have a higher skill set. And CNA2s, like I said, they work in the hospital right now. CNA2s typically, I'm seeing a lot of them start probably like the $19, $20 an hour range. But in a hospital, you have a huge amount of benefits that you don't typically see in a skilled nursing. And hospitals such as Providence right now, Providence Portland is hiring CNAs. And here's the big change with COVID. So hospitals are actually, typically they only hire CNA2s. Because we are in such a high need for CNAs, hospitals are actually hiring CNA1s as well now, which is not something that we typically see. And so Providence Portland right now is hiring CNA1s and CNA2s. And they have actually a $4,000 hiring bonus right now as well for that. So that's awesome. You could get your CNA1 if you're turning 18, get your CNA1, and you could literally apply to work at Providence and be working at a Providence hospital with amazing benefits and a $4,000 hiring bonus. So before, we were seeing only CNA2s in hospitals, and the last 6 months, hospitals have actually started hiring CNA1s as well. So again, that's a great time to get on with a hospital. Let's see. Yeah, like I said, growth, opportunities for growth. If you're a CNA1, you get hired at a hospital. A lot of hospitals have built-in CNA2 programs. So you can actually do kind of on-the-job training and get your CNA2 while working for that specific hospital. Very, very nice, very easy to do. Compensation, kind of already covered that. Let's see, best part about this event. Do you have a link to your program? So I can actually type in our website here. It's just morenurseconsulting.com. We have all 3 of our programs, the CNA1 or the NA1, the CNA2, and the Med-Aid on there. I didn't touch a whole lot on the Med-Aid. If you guys are curious about the Med-Aid, you can ask me. That's a skilled nursing facility position as well. I focus more so on the CNA because there's a lot more room for growth for a CNA, especially in a hospital. They're starting to put CNAs in trauma areas, in the emergency room. They're in oh my gosh, why am I like drawing a blank now? Surgical units, CNA2s in hospitals really get a lot of experience because they can go all over. How much does it cost to be in the program? So cost for our CNA1, let's see, did I do that right? Cost for our CNA1 is $1,500. Our CNA2 is actually only a 3-week program. It's a shorter program. You have 2 weeks of classroom time. Then you only have 1 week of clinical, which is currently it's at Tuolity Hillsborough Medical Center. So again, right there in Hillsborough, you work for a week on their floors with their patients. And the CNA2 is $1,300. So it's a little bit less than the CNA1. We also have, if you reach out to me, which on our website, if you fill out on the front page, there's a contact us box that you can fill out. All of that automatically goes directly to me. We also have on the website, my personal cell phone is listed on the website. And a lot of students love to just even shoot me a text to ask me a quick question. So you guys are welcome to email through the website. You're welcome to even shoot me a text through the website. If you have just a quick question, you're like, oh, I was, in that presentation, or I watched that presentation video, I just want to, ask this real quick. Feel free to do that. My title is the program coordinator. I'm also the CPR instructor, but I am your guys' personal advisor. So if you want to go on to get your CNA2, if you want to go on and get your RN, then I want to be able to help guide you on those steps to do that. And so when it comes to, I was actually going to get to that next. And when it comes to cost, the tuition, as a CNA1, I work with a bunch of different skilled nursing facilities throughout the area. Because they are looking for staff, they are part of what we call our sponsorship program. What that is that you and I talk, we figure out kind of where you're at. And I look at which one of my facilities that I am kind of partnered with is closest to you. And then I have you apply to that facility to work as a CNA. Some of them, I have the applications myself that I send over to you and you just send them right back to me. Others, such as Avamere is one of them. I direct you to apply through their website. And so once you apply, or once you get that application sent back to me, I notify the hiring manager or the administrator directly at that skilled facility. And I tell them, hey, so-and-so just applied to you. They're one of my students. They're looking to get sponsored. If you can give them a call for me. Usually they will reach out to you within a week. Sometimes it'll be like the next day. And what they will do is they will do a typical job interview for a CNA position. If they decide that you're a good fit for their team, they will tell me, yep, we love Michelle, like we're going to sponsor her. And so what they'll do is then you and I will schedule kind of when a good class is to start. So it could be that the very next class you want to start in that class. It could be that the class after that you want to start, you want to give yourself a month to kind of get ready for it. We'll kind of get you all registered for that class, and that facility will pay the $1,500 tuition. They will cover all your costs for you in return for you coming and working for them once you complete the class. You can start working the day that you graduate. You can start working and you have 120 days or about 4 months where you can work as an NA1 before you have to pass your state test. So you can actually start working right away before you actually get certified. You just have to get certified within a 4-month time frame. So that gives you, that'll give you a job and you can start working right away, which is great. You have 4 months to get your certification before you can't work. And you have a year to get your certification before you have to take a class again. You get unlimited attempts to pass the test within that year. So I always tell students, try not to stress about it. We let you guys come back and practice in the lab. We help you as much as we possibly can. Most students who are organized, detailed, they stay on top of everything. They do very, very well. We also work with, I have different companies that I work with that give out grants to students. One of those being WorkSource. You will talk to them, apply through them, and sometimes they'll give out a grant, and they actually will give out grants for a CNA1, a CNA2, or a Med-Aid. Same with another company that kind of works alongside WorkSource Centro. They're based out of Hillsborough as well, and they will give out grants to students. So sometimes I refer students, depending upon situation, if I think that they'll qualify for help through Centro or WorkSource. sometimes I send them to those companies as well. So for CNA1, we've got a lot of different options that we can kind of go through and help you guys out with. We do also accept payment plans and things like that. What's good advice you would give to students? Definitely staying organized, staying on top of things. Organization and being focused, taking good notes, all of that is going to be huge. And especially for the medical field, study and learn as much as you can. I talked about earlier nutrition classes, physical fitness exercise or physical fitness classes, anything around mental health, physical health, emotional health. All of that is going to look good on a resume or look good that you have the knowledge in, and it will come in handy. It will kind of give you a better insight when you start working with people. Can you touch a little bit on medication aid? So medication aid, you need a CNA1. You have to be CNA1 in order to take a medication aid. You do not have to be a CNA2. CNA2 is kind of in its own category. For the medication aid, you are required to have CNA1 hours. So to take a medication aid class, they're the ones in skilled nursing facilities that administer all of the medications to the residents. That's powders, tablets, liquids, that's insulin, things like that. They check blood sugars, all of that stuff. You have to have 960 hours as a CNA1 in order to qualify for a medication aid program, which is roughly 6 months of full-time work. So you do have to have experience as a CNA1 to take a medication aid program. The medication aid program is more expensive. That one is $1,600. You have 2 weeks of classroom time. All three of our programs are 2 weeks of classroom time. The medication aid and the CNA2 are only 6 hours a day, whereas the NA1 is 8 hours a day. And typically our CNA2 and Med Aid are right now, they're usually in the evening. They're an evening class because they come in after the NA1s. So they usually run about 4 p.m. to 10 p.m. And the medication aid, so you have 2 weeks of classroom, and then you actually only have 24 hours of clinical to complete for a medication aid, which most of the time our instructor will either knock out in 3 8-hour shifts, or sometimes, depending upon the student's availability, because it is one-on-one, one student per the instructor, sometimes we'll do 2 12-hour shifts. And so we can knock out your clinical hours in just 2 days. The other thing with a medication aid is that there is a knowledge test. You will have to take a State Board of Nursing knowledge test to pass that one. There's not a skills test because obviously it's just medication knowledge, but that one you will have a State Board of Nursing knowledge test to pass before they will certify you. So how many times can you take the test? You can take the test as many times as you want within the first year. So if you graduate on June 15th, you have an unlimited amount of attempts until the following June 14th. They changed that, I don't know, I think it was like a year or two ago, where you have an unlimited amount of attempts now. So you can take it 5 times if you need to. Hopefully not. Hopefully you don't need it that many times, but yeah, you have unlimited attempts to take it. If you fail it, yes, you can retake it. You will have to, there are fees that you have to pay to take the test. There is a background that you have to complete, which is just a one-time background. And then there is the actual application fee that you have to pay, which I'm trying to remember off the top of my head. I believe it's $107 is the application fee, and then the background is like $62, I think. And to retake the test, I'm not 100% sure what the application retake test fee is, but I want to say it was only like $30. So it doesn't cost you as much to retake the test. And of course, you don't have to pay for that background again. And if you get sponsored by a skilled nursing facility, a lot of them will cover the background fee and the first registration fee. If you have to take it again because you failed, then you have to pay for that yourself, but a lot of them will cover those first time fees also. Can you be both CNA2 and medication aid? I always promote CNA2 over medication aid because of mainly the benefits. You may get paid very similar, but CNA2 again comes with all of the hospital benefits, 401ks, and medical benefits, insurance, all of that stuff is way better from a hospital. You're not going to get some of those things out of skilled. CNA2 is also, you'll get experience to more. So it'll get you, I think CNA2 will get you much more prepared for an RN than a medication aid will. You could be both, but again, CNA2s are in a hospital setting. Medication aids are only in a skilled nursing facility. So you could definitely have, we have students that do have both of those, that have a CNA2 and have a med aid. And we have students that come through and get their CNA2 and then they bounce into a med aid program or vice versa. You can definitely do that, but they are two separate, I guess, entities. They work under two different umbrellas. So you would be working in two different locations if you had both of those. So I don't necessarily think that's worth it to get both. I think that you would want to see where you wanted to stay long term. If you wanted to be in more of a skilled nursing facility where it's a little bit more slow paced, then maybe you want to upgrade and do a medication aid. Or if you like the action, you like it being fast paced, you like being in a hospital setting, then just focus on the CNA2. If you haven't taken the test within 1 year, you will have to retake an entire program. So you'd have to come back through that 4-week NA1 program or medication aid program, whichever one. All right. I think pretty much have covered almost everything. So if there's any other questions, you guys can feel free. Like I said, do not hesitate to reach out to me. You can, right now on our website, I believe we have our classes listed up through August. You can kind of see what the schedule looks like during summer. We will be posting fall schedules soon, but any questions you have, feel free to contact me. And definitely when it comes to financial things, if you're like, oh, I really want to do this, but I may need help, we've got multiple options there too. So feel free to ask me any questions that you guys may have. And hopefully we can get you guys going. And Centro, I also forgot to mention, I talked about Centro earlier. Centro has a particular person that works for them that actually focuses on high school age students. So he actually specifically gives grants to high school students. So, and they have been looking, as far as I know, I believe they've been looking to try to increase that to get high school students more prepared for careers. So we definitely have funding options for you guys that we can look at. So don't hesitate to ask me.
All right. Thank you so much. This is a lot of information, really good information. And looks like it's a lot more easier now to get into CNA. I took CNA 10 years ago and that was really difficult. And
Yeah.
looks like, it's like, wow, I should have just like either go through with it or like now, I mean, maybe I can go back and be CNA again.
Yep, we try to keep it as easy as possible, and definitely the career opportunities and job opportunities with CNAs has grown immensely from 10 years ago. There's a lot of jobs available for CNAs now that have recently started opening up more. So there's definitely more career opportunities.
And it's a really good advice to go into like being NA1 first so that you can really get into and pass the test. For me, I failed the test first because I did not go through because it was like, it was hard because you have to get your own time. So that's why it was like, it's good that you have that experience, then take the test within a year.
Yeah, definitely. I mean, volunteering is an amazing thing for high school students to do, especially if they do it in like a memory care, because that will really give them the exposure to the medical field to help kind of guide them on what they want to do. And then they can obviously use the volunteer hours towards their high school graduation requirements and everything too. So definitely encourage that. And if there are any students that are interested in volunteering at a skilled nursing facility, they're welcome to reach out to me also. And the facilities that I work with for the sponsorships, I can also refer them to those facilities for volunteering as well. So.
All right. Thank you so much. Yeah, I'll stop the recording now and